Hello, welcome to TechTurks. Today I have Jenny. Jenny is the founder of Clafiya. Clafiya is the digital hospital that comes to your home. So I guess democratizing access to healthcare. Jenny, thank you for coming to TechTurks.
Thank you for having me.
So first question, Clafiya, what does that name represent?
Yeah, so Clafiya roughly translates to community wellness. It's a way, and so the C stands for community,
Yeah.
and then Lafia is like how it's up for I'm well or wellness.
Okay.
And so it represents community health, like aggregating community resources so that we can access healthcare in our communities instead of having to travel far for it. Like we can just find healthcare easily.
Before we delve deeper into that, so Clafiya started about 2021.
Yeah.
So, what were you doing before that, and how did you end up, interested in, giving back to developing society?
Yeah, so prior to starting Clafiya full time, I was working at Amazon. How did I become interested in Clafiya? So I would say I mentioned earlier, I was born and raised in the United States, but at some point I did live in Nigeria.
Okay.
And so the plan was for us to come back here, live, and just get the Nigerian experience. And then when we're done, go back to the United States for university. But my parents experienced a few challenges, but particularly around health.
Yeah.
So I have two siblings that have a chronic condition, and it was just very hard for us to access healthcare. Not from a cost perspective, it's just, how do we ensure we get the best quality of care and where can we find it? Then in 2016, I started to visit Nigeria again as an adult, realized the same challenges my family and I had back then still existed or gotten worse. So I just became very interested. Yeah,
let's be optimistic.
Yeah. And so I just became very interested in the topic area. I never wanted to go to medical school. I just felt like for the things I can do for healthcare related can be done outside of the hospital setting. So I started school at Georgetown University. I was getting my master's in systems engineering there. My professors just asked us to pick a topic that we're interested in. So what big problem can we solve from a systems perspective? And I just picked healthcare in Nigeria. My professors then encouraged me to think of it as a business because it wasn't a business in my mind. It was just like, oh yeah, I'm gonna do this great thing and give back to my community and whatnot. So they encouraged me to pitch around Georgetown. I participated in a few pitch competitions, won some prize money, used that for customer discovery, and kept going back to Nigeria just to learn more about health and access to health in Nigeria. So by that time I was working at Amazon now, fast forward to Amazon, and TechTurks wrote an article about Clafiya in April 2021. I didn't know anything about TechTurks at the time.
Yeah.
They just wanted to write about us. I was like, yeah, sure, no problem. And so they did, and it went viral. And so that's how our first investor, Microtraction, found us. They reached out, they said they wanted to meet us. And we weren't fundraising, we weren't thinking about it. So we pitched to them, and I remember praying to God that if they invested, I will quit my job. And they decided to invest.
What you wish for.
Yeah. And then they decided to invest, and I quit my job at Amazon, and I've been working on Clafiya since then.
Excellent. That's a great story. So I know, I hear that you're in Lagos and in Enugu. So in that area, who's your target market?
Yeah. So when we started Clafiya, we wanted to target underserved, and as I kept saying that and staying in the market, realized that underserved can mean so many different things. It could mean bottom of the pyramid. It could mean people living in big cities and just can't access healthcare because they just don't know where to find it, and it's not a cost thing. So we had to start narrowing down what underserved meant. And so we started to target small businesses, people who lived in semi-urban, urban areas. We really wanted to do rural, but just found out that there was just so much we needed to do in that area, and we didn't have the resources to do that. So we started to focus on semi-urban and more urban areas. So that's why we started in Enugu. Actually, the reason why we started in Enugu is because we wanted to make sure we weren't solving for a Lagos market.
That's your own.
Yeah, exactly.
Yes,
and
exactly.
I'm from Anambra, by the way.
Okay.
I'm actually not from Enugu. But we just wanted to make sure we weren't solving for a Lagos market. And then so we started to pilot. We were getting information back, and it really informed what made Clafiya today, which is what I described as a digital hospital, right? Focus on like that initial primary care, but then care navigation.
So it's a platform, right? A digital platform that connects people that require service and people that can give service. So so who are your stakeholders in that platform? So like apart from the customers, then you have doctors.
Yeah, so we have health practitioners, nurses, doctors, and then like what I would call operational partners. So like pharmacies, diagnostic centers, hospitals, specialists, and then we broaden it out to wellness. So gyms, spas, beauty, wellness. So you come on a platform, you sign up, and then whenever you need to access a health practitioner, either virtually or in person, you can do either or. So do a teleconsultation, or we'll send like a nurse to your home. And while he or she is there, they're also on a video call with a doctor. So it actually feels like, the hospital came to your room, your living room, place of work, wherever is comfortable for you. And then for continuum of care, we have partners, so the pharmacies that can help with medicine delivery, or you can go pick up your medicine, referral to hospitals, so that, when you get to the hospital, you're not waiting for a long time. We've already called them to let them know that you are coming, and they will attend to you almost immediately.
Jenny, does this actually really work? I mean, this sounds like novel and like...
Yeah, it does work.
In Nigeria?
Yeah, that's why we're here. Like, we're existing.
And how much, it sounds like a logistic, in fact, it sounds more like a logistic business than a healthcare business. How many people are on the team, and how do you onboard? How do you onboard? How do you market? This sounds like really, it sounds simple, from a customer perspective, but behind the scenes.
There's a lot of hard work. So right now there's 20 of us.
Okay.
We're split between tech, product, operations, and then marketing. So a lot of the operational parts comes from customers finding us, then trying to schedule appointments. That is digital, that our platform does that digitally automatically. But then the care navigation part is where we're now working on what I said earlier, we've kind of evolved into something else, where we have that seamless, care navigation. So you're not necessarily relying on Clafiya to refer you to a lab next to you or a hospital. You can easily find them in your community. So now we started to aggregate a lot of health partners, a lot of wellness partners on our platform. And then very soon you'll see the next update that will come is that you'll be able to search for these partners next to you, but then you're able to pay them directly. So it takes a lot of the work that we have to do, and it just puts that autonomy in the customer's hands.
You're commission based.
Yeah, so there are a few ways we make money. So we're first a service provider. So we make money based on the healthcare visits that we do, either through virtual or in person. And then we make commissions from our partners, right? Every time we refer a customer to a diagnostic center for lab work or mental health or pharmacy, we also make commissions from that. There are other parts that we're adding to our model that will open new revenue streams for us. There's a bit of a fintech play, and looking to distribute through financial services, payroll, just to help people access care in a more creative way, in a way that is more conducive to the realities I feel in Nigeria we experience. It's not health insurance, so I know some people would like to put us in that category. I would say it's insurance or health assurance. So you're paying for the care that you need, as opposed to you're paying for healthcare just in case.
Trust. So like, I mean, how do you ensure that the trust level in the system? Because you have your customers, why do they trust you? You are putting on you're bringing pharmacies in, doctors. How do you trust that those people are capable, that they're going to provide that services, that they're not going to create any bad experiences? How do you manage all that? Because that's, I think your business is based on trust.
Yeah, exactly. And so we were talking about fundraising, and I remember when I would pitch to investors, the thing I would tell them is that like we have to really work on building trust. And that's really our biggest value proposition, because without it, like our customers will not use us. I mean, we always hear about like Nigeria being a low trust society, and I have my thoughts about that. But I mean, for us, we have to build confidence, we have to build trust. And so that's ensuring that whenever you schedule an appointment, like you'll get it right then and there. If you say we're sending someone to your home, like someone will come to your home, if not early than the time allocated. If we're saying that we're going to help you get your medicine and work with our partners to deliver that medicine, we make sure that we do it on time. But if there's any snags, we are also like communicating to the customer so they're not left in the dark. We have a long way. I won't say that we've got it all figured out, but I'll say like for now I think we're doing pretty decent.
Excellent. So talking about your ecosystem, so how many people have you served? How many doctors do you have? How many pharmacies? How many hospitals?
Yeah.
How many businesses?
Yeah, so as far as businesses, we have about 150 on our platform. It's a new product that we just launched, Clafiya for Business. So we help businesses, SMEs, provide healthcare for their employees. We give them like a health wallet that they can use to just save, and then whenever their employees need access to healthcare, they can do that. So it helps with transparency, helps with budgeting. Then as far as the retail part, we have about 3,000 customers on our platform. For the health practitioners, so if we're considering doctors and nurses and community health workers, we have close to 400 across the country in our community. And so that helps ensure that wherever our customers are, if they need access to healthcare, we can at least send someone to their home, or they can do it virtually. You asked about like partners. So we have, I would say, about 400, but I will split them into two. So we have about 80 health partners that we've signed like strategic agreements with that can give our customers discounted service whenever they access healthcare through us. And then we have like majority of our health vendors that are just on our platform, but they're there. It's like an Amazon for care, like a marketplace. So if you are looking for a hospital next to you, you can easily find it and then go there and access healthcare. So it's a way we drive customers to those vendors. Haven't signed anything strategically, but still a way to let our customers spend their money the way they want to spend it. So, and in different places too. So that's how I would describe.
That you've answered the question. Okay, last question. We have many more, but like I've got this. So what's the big plan? So like this time, for example, this time next year, when do you see Clafiya? When you see Clafiya, and how do you want the public or the market that you serve? How do you want to see you guys?
Yeah, so for us, we're really working on distribution. So like I said, like working to distribute through fintech. We tried doing that through health insurance, and then realized that health insurance probably will not be the way to go. But we know that like fintechs or banks are looking for ways to provide like value proposition for their customers, and health is one way to do that. So we are hoping that we would have announced some partnerships with either some fintechs, some banks, with payroll, HR as well. We have a few that we're speaking to, hoping to integrate with them. And then hopefully that people will see us as the go-to for healthcare, like the Google for healthcare or the Amazon for healthcare. I'll say Amazon for healthcare. If you're looking for a service, if you're looking for a product, like you know where to go on Clafiya. We help you access care, but we can also help you navigate a fragmented healthcare system. That's like the big plan for us.
Fantastic. Jenny, thank you for coming on TechTurks, and we'll continue the conversation offline.
Thank you so much for having me.
Thank you.